Macy, you'll read it and then read it all the way through.
Okay.
And then at the end of it, I may ask you a few questions.
Okay.
Okay?
Uh-huh.
Are you ready?
I guess. Yeah.
You go.
Okay. Dear SVH Health Center staff, on January 1st, a life changed when I had a stroke. My family was told that if the aggressive ammonia treatment didn't work, I would need to be put on comfort care. I'm so fortunate I was able to be cared for in my community at SVH. To my CNA, Chase, I was so nervous when I first came to this unit and was unsure of what to expect, but you were there. With each caring touch, you made me feel calmer and reassured that everything was going to be okay. You gave me great guidance in every task, and I knew I was in good hands. To Amanda, Jenny, and Helena, you took care of every request I sent your way. Amanda, the first night I told you I ran hot, and you went and got me a mattress pad and a fan within a half hour and made it all better. Jenny, you are the Johnny of the spot. You had no excuses about being busy, and you also made sure to introduce yourself to every interaction. Helene, you were always buzzing around, taking care of things, and had the matter-of-fact attitude, which I greatly appreciate. Macy, you always came in my room to take my order with the utmost enthusiasm, and I can tell you really love your job. Tino and Michaela, I work with you the most. The teamwork, communication, and your caring heart were unwavering. I felt like every day you said, "You can do this, Judy. You got this, Judy." When I hit my milestone, you were all cheering me on loudly. 4 weeks later, I was ready to go home and continue my care, and I owe it all to every single one of you. A good friend once said to me, if you are a good person, somewhere, some way, it will come back to you. And this is certainly what happened to me here. I firmly believe that I was meant to be in this place, and I was meant to be alive and here. I am so close to the old me as possible.
Oh, so sweet.
Do you know how hard that was to not start crying?
Oh, Judy. Oh,
that
that's
is
so cute.
I love that.
So Tina, what did you think hearing that?
I mean, that's what our goal for SVH is trying to provide. We try to make people feel that they're getting the best level of care and to be seen as an individual and a person instead of just another diagnosis or treatment. So yeah, we try to make everyone feel comfortable, and I'm glad that people see that and they feel it.
I think it shows that we just have a really good team here at SVH, and we all have our patients in mind. We all want to help them as best as we can, and that's our goal, and it's really nice to hear this and get that feedback and reassurance.
I don't know, because I always start crying. I'm a very emotional person. Oh, don't do that. I'm going to start crying. I love working here. I love the patients. Oh, okay.
Okay, you're allowed.
I'm an emotional person.
And it shows all levels of our team are involved with the patient care. I think that's what makes this place special, is that everyone's pulling in the same direction. And I'm glad that the patients feel the same way, yeah.